heartbreaking that because there is a lack of humanity, there is a lack of sensitivity, there is a lack of just overall dignity, respect. It's all missing. It's missing because to me, it truly is about humanity. This is a human being. This is someone who is clearly in distress, clearly suffering. And you do nothing but continue your administrative function of typing.
Black women, Black American women, are 3 times more likely to lose their life in the process of maternity. 3 times more likely. And that number has not changed for years.
So in the US, we have the highest rate of mortality for women of color, especially Black women. But overall, compared to other nations who compare to us
Wow.
on the same scale,
Other nations.
we have the highest rate of maternal mortality. That right hip pain was a blood clot that traveled from my hip to my lungs. The pulmonologist said, I don't know how you delivered your child and you are still here.
Praise to God.
That's the problem.
Then the baby drops out of me. And the baby is hanging out of me.
No one should ever lose a child, lose their life, trying to give life.
Thanks for joining us on today. We are HERpresence. We talk about things that are uncommon. We talk about things that may be controversial. And today we're going to talk about something serious. We always talk about something serious. Sometimes it may not be serious to other people, and it's serious to me, or serious to you, or maybe even you. But today we're going to talk about something that's serious for everybody. Everybody. So, we're going to talk about Black American women and the mortality rate in childbirth. Mortality meaning the passing or the loss of life during the maternity process. There's a video of a young woman giving birth, or in labor, I should say, out of Dallas at a hospital, and it went viral. So most of you guys have probably seen it, but just in case you haven't seen it, we're gonna play it right now.
When's your due date?
Right now.
Is your due date 11?
What?
How many times have you been pregnant?
3.
This is your 3rd pregnancy?
Yes.
You have 2 babies
It's
at
in
home?
my ass.
You have 2 babies at home? Who's your doctor?
Lang is her doctor. Y'all treat all your patients like this or just the Black ones?
Beverly, this is the first time patient for you. Alright, last name is Jones. She's G3P2. I'm not sure when her due date is.
Her due date is
Just
the
said it was
10th.
the 10th.
I think her due date's the 10th.
She got 3 pregnancies, 2 babies at home.
2 contractions are another 2 minutes.
I bet y'all listen next time. When you found out you was delivering at this hospital, your ass should have changed doctors.
Thank you.
Everybody say how they treat people here.
So, what do you guys think about that video? What are your thoughts on that video that was just played?
I think there's so much to say about that video, and I think one of the things when we look at that video is we see someone that looks just like us, that is in pain. So to see her in pain and screaming and yelling, it causes me pain because I remember what it was like to be pregnant and in labor with no pain management and to watch the response of the nurse is absolutely heartbreaking.
Wow.
It's heartbreaking that because there is a lack of humanity, there is a lack of sensitivity, there is a lack of just overall dignity, respect. It's all missing. It's missing.
Yeah.
And my question is, why? Why? How can you listen to someone scream like that and do nothing?
I don't care.
Yeah, yeah. And I mean, there's a lot of things that go through my head or regarding that, but I'll let someone else say something because I said my initial thoughts. Yeah.
Yeah.
Yeah, when I saw that, that hurt me to my core. That hurt me to my core. To be honest with you, I wasn't even sure I was understanding what I was seeing.
Mm-hmm. Yeah.
And I had to watch it again, and I
Mhm.
thought maybe this was a sham. This wasn't a serious video.
Mhm.
Um, to see a woman in pain,
Mhm.
and especially when we're talking about childbirth, and not show any type of empathy,
Mhm.
to not try to help her,
Mhm.
to ignore her.
Mhm.
Um, I couldn't understand it.
Yeah. Yeah.
And it also made me question, was that behavior allowed?
Mm. Right.
Is it acceptable
Right. Right.
in that hospital
Right.
if you can do that? So, yeah, that hurt me to my core. I've worked in hospitals. I've
Mhm.
seen patients come in hurt, um, confused, dazed, needing care, needing help. And even though I'm not a nurse or in that medical field, I made sure I at
Mhm.
least got someone to come and reach out and take care of that patient.
Right.
Um, but yeah, that was just unacceptable.
Yeah.
I think for me, when I looked at it, my thought was, what is going on? Um, how long does it take just to call and say, can y'all come and help this lady as I do the administrative part of it?
Mhm. Mhm.
When you say, is this allowed, this behavior is allowed? Well, obviously it's
Yeah.
allowed
Yeah.
because the lady that was the African American lady that was in labor, obviously in labor,
Mhm.
the woman, the administrator, whoever, admin, whoever this lady was, never showed any type of urgency.
Mhm. Mhm.
And it reminds me of a situation that happened to me, and I'll talk about that later. But um, it was to see that I had to stop it
Yeah.
here and there, and then and watch it because was hard to take.
Yeah. And there are so many things that I can go, being a nurse a few years, uh, as far as the role and what should have taken place. But I think it's a bigger picture than that, right?
Yeah.
So you have your protocols, you have the things that you are policies that you are required to do.
Mhm,
I want to put all that to the side
mhm.
because to me, it truly is about humanity. You, this is a human being. This is someone who is clearly in distress, clearly suffering, and you do nothing but continue your administrative function of typing and can you tell me your da 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 da? Can you give me this? The lack of compassion. And you said it, Kelly, the lack of empathy. Just to know that someone is in that kind of pain, whether you are medically trained or not,
Right.
you do something.
I didn't get it.
Yeah.
I
Hey.
didn't get it.
Yeah.
You went on about your daily functions
Mm-hmm.
as if this person has a cold.
Mm-hmm. Right.
This person is in active
Yes.
labor.
Yes.
And as a woman, we can assume
Mhm.
she's in great pain.
Right. Right.
And to ignore that and to
Mhm.
act like it's no big deal.
Mm-hmm.
Mm. And the question to that is this what they do across the board?
Mm.
Is this what they do to all the patients that come through there? And today, because we're talking about maternity and the loss of a life that's connected with that, I want to talk about a couple of our we all
Mhm.
actually
Mhm.
want to talk about a couple of things. So I don't know if you know, but Black women, Black American women are 3 times more likely to lose their life in the process of maternity. 3 times more likely.
Mhm.
And that number has not changed for
Mm-mm.
years. The mortality rate or the loss of life uh, from uh, childbirth or just the process of going through childbirth um, has declined actually, but Black American women, that one has not. That's an issue. What do you
Mhm.
guys say about that? Any things that you know about? Any statistics that you guys know?
Well, I printed something out just the other day. So in 2023, according to the latest data from the Center of Disease Control and Prevention, which is CDC, the maternal unlived rate per 1,000 live births for Black women, it was 50.3 unlives per 1,000 live births.
100,000.
100,000. I'm sorry. Thank you. 100,000. Um, that's more than 3 times the rate of Caucasian women
Wow.
in the United States, of women of color.
Mhm.
Of women of color in other ethnicities, it's 12.4 for Hispanic women and 10.7 for Asian women.
Mm.
So why the disparity?
Mhm.
Wow.
I say, baby, we got a problem.
That's what we say.
We have a
Yeah.
problem.
Because when we think about, let's talk US overall, right? So in the US, we have the highest rate of mortality for women of color, especially Black women. But overall, compared to other nations who compare to us
Wow.
on the same scale,
Other nations.
we have the highest rate of maternal mortality.
That is so
Me
crazy.
that's crazy. And not just mother, but we're also talking about the newborn. So even in Texas, I can recall driving down I-35. We all know I-35. There was this billboard and it said, everything is bigger in Texas. And I'm like, sure is, including the infant
Wow.
mortality rate.
Wow.
That's sad.
So when we bring it home, we've got US statistics that show that we have a problem. But then we bring it home to the state that we live in,
Yeah.
and we've got a big billboard that indicates that we have a problem with mothers being pregnant, especially women, Black women, women of color, and not also not in addition to the infants
Mhm.
are not, they are more likely to die within the first year of life than any other infant. 3 times more likely to die will not see their first birthday.
Wow.
That's a problem.
That's a big
It's a
problem.
problem. And the other reason, or the other layer, I should say, on that is these deaths are 70% of the deaths are preventable.
Absolutely.
Preventable.
70%.
Preventable.
Yes.
70%
Yes. Yeah. Yeah.
are. And so the question is, what do we do about that?
Well, so I think when we're talking about what do we do about it, I think that it is one thing to give the numbers and share the numbers, but I also feel like I've seen it in my own life.
Mm.
I've seen it happen to me. I've seen it happen to family members. So I feel like that's something that I know I would like to share and kind of tell you a little bit about a
Yeah.
story in particular. I know for me, while I was pregnant, mind you, a few years ago. Yeah. But I kept having right hip pain. And I remember going to every prenatal visit, and I would tell my obstetrician, I would tell the team, hey, I have right hip pain and it's just not going away. And that pain, it's unbearable. I can almost not walk. So I'm going in. And you have all of these visits up till delivery, right? You have, every 6 weeks, every 4 weeks, then every 2 weeks, right? So all this time I'm going in saying every visit, I can't get rid of this right hip pain. And the answer that I would get every time is, there's nothing wrong with you. You're just
Mm.
tired of being pregnant.
Wow.
And I'm like, okay. And so when you hear that over and over again, you start to think, okay, maybe I am just okay, okay. I trust them. They're my providers. They're my doctors. If they're saying it's nothing, they see 100 people just like me every day. Okay, okay, okay. They know. Then they know. So I'm like, okay, I guess I'm fine. Do the stretches, do what I need to do. That pain was not going away. I delivered our son, and 2 weeks postpartum, in the postpartum period, I remember having this just unbearable back pain. I'm like, oh my God. I just feel like I can't breathe. There's something going on here. I feel like I can't breathe. What is this? And so I'm like, call that number. Call. They said if you have any signs or symptoms, call the number. And I'm calling the number, and I'll never get what that triage nurse said to me. I'll never forget it. She said, "You're just tired of. Uh, I'm sure there's nothing wrong with you. You just probably have a UTI. Just come in."
Wow.
And in that moment, at the time now, mind you, I'm a nurse, but I'm a new nurse. So I've only had worked the med surgical floor. So I really didn't know about obstetrics. I really didn't understand it. And so I said, you know what? But something on the inside of me said, go to the ER right now. You know, this is not a UTI. Go to the ER. And I go to the ER and they put me on the monitor and they put the pulse ox on me to look at my oxygenation. And they immediately rushed me to the back. And I'm like, okay,
Wow.
what's going on? What's going on? What's going on? My oxygen level, it should be, of course, 95% or higher. I was at 80 something percent. They do a ultrasound, they do everything, they do the testing, and come to find out that right hip pain was a blood clot that traveled from my hip to my lungs.
Could have died.
The pulmonologist said, "I don't know how you delivered your child and you are still here."
Grace of God.
I that's the problem. You present a condition, you present signs and symptoms, and I was ignored.
Ignored.
Ignored for several visits, ignored and pushed to the side and said, "There's nothing wrong with you." So, we have a problem.
Yeah, we have a problem.
We have a problem.
Um, I also have a personal event that happened to me. So pregnant, went into labor early, um, and so I was at an event and went to go use the restroom, and it was different. It was weird.
Mhm.
So I came out of the bathroom, and some friends of mine, they saw me and they could tell that something was wrong. So they rushed me to the hospital, and as we're going to the hospital, just pain. Um, I remember my daughter, she was like, "Mommy, are you okay?" She was little. And I was like, "Mommy's okay, but I'm just hurting." And I knew that,
Mhm.
it's about to be serious. So I get to the hospital, and y'all, I have blood all from here all the way down when they wheel me into the emergency room. You can see that there's something seriously wrong.
Mhm.
Mhm.
And I'm sitting at the desk at what is that, triage?
Mhm. Triage, yeah.
Sitting at the desk. And as just like the lady that was in the video that we saw at the top of this segment, the lady, there was no urgency.
Mm,
She was like, "Well, we need to get all of her information first, and then, we have to prioritize." This is what she's saying.
mm,
And I'm like hurting. I'm like,
mm, mm,
and my girlfriend is standing there, and I'm like, "I'm hurting. I think I need to go to the restroom. I
mm,
need someone." And she's yelling, "Someone needs to come and help her." And the lady is like, "Wait, ma'am.
mm,
We hear you,
mm,
ma'am. Hold
mm,
on, ma'am." And so then finally I say, "I gotta go to the bathroom." So she takes me, wheels me into the bathroom. She helped my friend, she
Yes.
being my friend. She helps me out of the wheelchair and puts me on the toilet. And then the baby drops out of me.
mm,
And the baby is hanging out of me.
mm, mm,
So she runs out the bathroom, and now she pushed, in this particular hospital, you can just like push the doors open. She pushes the door open and then she's yelling, "We need someone. Her baby is hanging out of her."
mm, mm,
And the next thing I know, I hear the gurney coming into the bathroom, and they are putting me on the gurney.
Mm.
Uh, the baby, and I had twins,
mm,
but those twins are not with us today.
mm, mm, yeah.
And it's funny because when I shared this story with y'all. Melissa, you said, "And did you sue?" I didn't even think about that.
Right,
Not until
right.
you even asked. That was like now, and that was over 20 years ago.
Mhm.
I never even thought about that.
Right.
That's not, and that wasn't in my mind. And something else that we talked about then when you asked me that was, but I shouldn't have to be an attorney. I shouldn't have to be.
Right. A nurse.
I'm the
Right,
patient.
A nurse.
exactly.
It's the
I don't
patient.
I
Exactly,
should not I
exactly.
should be the patient
Right, right.
and should be treated with gentle hands and professional hands and caring hands and
Dignity and respect.
dignity
Mhm,
and humanity and
mhm.
all of that. But
Right.
I was ignored.
Yeah. Yeah.
You were handled.
Yep.
I was handled. And it wasn't, and you can't say, well, what if they didn't understand what was going I had
No, 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 no,
blood.
no, no. So there's certain things you just can't excuse. I'm just sorry. You just cannot excuse it. And your story, the all these stories, they anger me so much because there's a failure in the system. There's a failure in the system. I believe. But first of all, let me say this. I'm so sorry that happened to you and your family. That's first. No one should ever, ever lose a child, lose their life trying to give life. That's number one.
From things that are preventable.
Right. All it requires is intervention. And people are trained to do those interventions. And for them not to do it, I don't want to use that term. I'll say it's sad. I'll just go there. It's very sad that they're not doing the interventions. In all of these situations, and I know our listeners, they're going to have their own stories. They're going to have their own stories. They're going to have their own situations. They're going to have their own how they have been treated in seeking care at the most vulnerable time because no one goes to a hospital because they just want to go hang out. You are going because it is a vulnerable time in your life where you need care and you need the assistance of professionals. And to know that we have people that are just showing up and not doing what they're supposed to do
Yeah.
is absolutely ridiculous. Ridiculous. And something has got to change. Something has, no, not one more mother, not one more baby needs to lose their lives ever again because people are not doing what they're supposed to do.
Right. Wow. You know, and um the fact that you yourself had a personal story,
Mhm,
I had a personal story, speaks to the chances
mhm. Hmm. That's the
of
statistics
you
right there.
no,
That's a
right,
statistic right
no,
there.
right,
Yep.
that you probably know, if not your own self,
Mhm.
know someone who had a personal situation, their own self.
Yep.
Um, or check this out. Or if you had a child, it probably is something that happened in your situation and you didn't even know it.
Right. Right.
The way you should have been handled,
Yep.
you weren't handled in the right way.
Mhm.
Right.
And you statistically, chances are it happened to you also.
Yep. Yep.
What if you weren't a nurse and just said, let me get up because I know I don't have a UTI.
Mhm.
So let me get up. What if I didn't have my screaming girlfriend there
Mhm.
and
Mhm.
I just sat there? What could have happened? Not only would I have probably lost the babies, but lost my own life
Right.
Mhm.
Absolutely.
sitting in that wheelchair.
Yep. Yep. Yep.
So,
And that is the horrible reality. That those are the numbers. That's what we're talking about here. We are still here. There are so many mothers, so many women who are not.
yeah.
And not just we talk about losing life, but I also want us to also think about injury
Yes.
because there are a lot of people who are injured and it's never ever discussed, it's never brought to light.
Yes.
That's important too.
And I think the call to action for that is, have you been injured and have you talked about it?
Mhm.
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 What is the call to action? Like, what, and I asked this earlier, what do we do about this?
Yeah. Yeah.
And I know that there have been people have done things, right? But what do we do? Like, what can you as an individual do about this? Because sometimes
Mhm.
I think, like, somebody's doing something. Obviously, somebody's doing something about
Right.
this.
Right.
This is so serious. Someone should be doing something about it. I know someone is. If we look it up on our internet, we'll find that
No.
somebody is doing something.
Mhm.
But what do
Mhm.
you as an individual do about it?
I think Kelly had some great,
Mhm.
great ideas on some things that sure.
You know, there's a couple things. One thing is you know your body.
Mhm.
You know yourself.
Yeah.
When something is not right, when something does not feel right, um, you need to stick with that.
Mhm.
Don't be challenged to see it in a different way when, no, I'm going through pain. This is not something else. This is pain. Um, I know I worked in different hospitals, and in the early 2000s, one of the hospitals that I worked at in Austin, we really were um, trying to get patients to understand is that you have to be your advocate for yourself.
Mm-hmm.
Mhm. Mhm.
Um, don't be talked into something that is not going on with your
Mhm.
body or in your body.
Yeah.
Right.
If you don't feel that during your time of need that you can communicate that, it's also important to have somebody that you're close with that knows you,
Mhm.
that you can have those conversations with them ahead of time so
Mhm.
that if you're not able to discuss, answer questions, or you may even forget something,
Mhm.
that that person can be your advocate and can have those conversations with the doctor or the care provider.
Yeah.
Yeah.
So please, please, please do not be convinced. If you have something going on, you need to make sure that you stay on that topic and do not be convinced to see it something else.
And I will say, because I that situation that I went through was a pivotal point for my life
Hmm.
as I take care of my family, as I take care of myself, as I think of overall as a consumer of healthcare.
Right.
For me, I no longer, if I feel a certain way,
That's what
I
it
am
is.
not going to accept it's normal.
Mm-hmm.
And I'm going to go back to even when I tried to take birth control pills.
Mm-hmm.
I'm going to say this. I had a practitioner tell me, it's all in your head. That's why you're sick. That's why you can't take them.
Mm-hmm.
Every time I would put a pill in my mouth,
Mm-hmm.
I couldn't.
Mm-hmm.
And they made me feel as though I have some type of issue going on that
Hmm.
I just don't want to take the you just really don't want to take the pill.
Mm-hmm.
This is what they do.
Right.
We can no longer be silent and accept what we are told. There is nothing wrong with questioning, and there is nothing wrong with getting a different provider.
Exactly.
It's like when you are going shopping for whatever. If that one doesn't suit you, what do? You move on to the next.
Right.
There is nothing wrong with being an advocate for yourself, means that I am looking out for the well being of me,
Right.
my family
Right.
members, and everyone involved. And I am going to take the necessary steps to speak up.
Hmm.
If you're telling me, I'm telling you, I'm having this right hip pain, and you're telling me I'm tired of being pregnant, guess what? You're not the right person for me.
Right.
Right.
I need to move my care someone. I need to seek a second opinion. And all it took for my situation was someone to do a simple ultrasound.
That's it.
Yeah.
If they would have did a simple ultrasound, they would have saw the blood clots sitting in my legs. My lungs would have never been impacted. But because I was ignored and I didn't know any better, and this is why I love this forum, because we're going to reach somebody. So you, from now on, you don't have, there's no excuse. Speak up, say something. If you don't like it, get a second opinion. Your insurance, whatever your insurance might be, it does not matter,
Right.
gives you the right as a patient, as a consumer, for you to speak up and speak out. And also, don't accept being treated a certain way.
That's right.
Hmm.
Don't accept that.
And you don't have to have insurance
Right.
to still be treated
Right.
with dignity and respect.
Absolutely.
And it's also
Absolutely.
okay to write down.
Yes. Yes.
Take notes, do research.
Yes.
So when you have that opportunity to speak to the doctor, the nurse, or what have you, that you can come up with your own
Mhm.
questions regarding possibly your own diagnose.
Yes.
But be engaged. Be
Absolutely.
engaged.
Absolutely. And even if you don't understand, I say if you don't understand, because sometimes I think about my sister, I didn't know the questions to ask.
Right,
I didn't
right,
know.
right,
And at that time, it wasn't like as internet friendly as we are now, right?
right.
Now you can Google everything and everybody can tell you everything. Dr. Google can help you out. But even if you don't know, just keep asking.
hmm
Just keep asking. I'm having this, I'm having that. Can you tell me more about the condition? Can you tell me some other options? Can you give me another alternative? And what do you think? I'm gonna stop because I want to keep. I can keep going on this.
Which is
No.
well, honestly, there's
Yeah.
no end to this, and
Yeah.
I think that that is the point. Talk about it.
Mm-hmm.
Um, this is not um someone else's problem. This is your problem, even if you're not African American.
hmm
It is your problem.
Right.
hmm
And so for me, the call to action is to talk about it. This is a local issue. These things happen not just in your state, not just in your city, but in your neighborhood and probably even in your house.
Mm-hmm.
So talk about it. Anytime, um, has anybody ever just been on social media and you hear about something that happened like down the street from you, or been watching the news and how it affects you?
Mm-hmm.
That's why you have to talk about your story or something that someone that you know that's around you, talk about it.
Mm-hmm.
Because what happens is people hear it, and because it's personal to them, because they know you, then things begin to happen.
Mm-hmm.
But as long as we are just like, wow, that's so sad. And it is.
Mm-hmm.
Wow, what? Man, I'm glad someone's doing something about it. But you should do something about it. And it's as easy as just talking about it. It's as easy as just going out and talking to friends about it, putting it on the event or the personal story, if you're comfortable with it,
Yeah.
in social media. Because then it begins to go out, and certain people who have um, reach
Mm-hmm.
begin to make more of a rumble,
Right.
you
Right.
know, of an earthquake
Mm-hmm.
in this I'm gonna say racism. I'm sorry. It's
Yeah.
systematic,
Yeah.
you know,
Yeah.
it's
I mean,
systematic.
that is part of the issue.
Yeah.
Yeah. Yeah. That's part of the issue.
Um, so that's my call to action, and that's what I would request that people do.
Melissa, we were talking, offline on this subject, and you mentioned that more and more Black women are seeking not midwives, but who are they seeking for um, being their advocates as well during
Yeah. So
childbirth?
one of the things that there are so many things, so many programs, but one initiative out there is having a doula at
Yeah,
birth.
there we go.
And I'm gonna just issue my disclaimer. Let me tell you my story. Been a labor and delivery nurse for a long time.
How long?
Goodness.
Let's
You gonna make me
put a
say
number
it.
to it.
Okay,
Let's put a
okay.
number
That's
to
a
it
good
because you
number.
acting like it's 5 years. Let's put a number to it
I've been in nursing
with a
over
doctorate.
26 years. I've been an L&D nurse specializing in women's health for at least 20 of those
And
years.
then recently,
Recently received my doctorate of nursing practice. So,
okay,
yay. Yay. But I would tell you,
had to get that out there.
I know, Kelly.
Right,
Look at you, Kelly.
right.
Yeah. But the thing is, there were many years ago that I would, if you said I'm bringing a doula to my delivery, why do you need a doula? I'm going to take good care of you.
Mhm.
I'm going to make sure you have everything you need. I wasn't comfortable with it. But now that thought has changed completely. There are too many women who don't make it out of that delivery room, who do not make it out of the hospital. So we need all the support and help and advocates that we can get.
An advocate.
So I'm very supportive of having doulas. I'm very supportive of having your labor coach. I'm very supportive of whoever you want to have in that room. Have them in there with you. This is your experience. This is your opportunity. You only get one birth experience every time. It is unique. I don't care if you had 10 kids, that one delivery is unique. And we want to be able to honor that and support you. So having someone there who can, and I think too in healthcare, I'm a firm believer, we need more people who look like the people who are in the bed.
Correct.
So
Correct.
that's another issue that we have. We've got to push for, when you say a call to action, that's my other call to action is pushing these programs and these opportunities, because how can you truly take care of someone that you can't even relate to?
Right.
It's a problem.
Right.
And so we need more nurses, more doctors, more midwives, more doulas that come from that background, that same culture, because it just creates, it fills in the gap.
Right.
You have the knowledge, that's the book knowledge, you have the information, but it's something else when you understand the culture. Because we're
Yeah.
different. We're different. My labor, I remember going into labor in Germany. It was a totally different culture. And I'm going to tell you right now, I screamed and hollered my entire delivery with my first son. And I would never get the German nurse saying, "You need to be quiet. We don't do that."
Oh.
And I just was like, "I'm sorry, but I do. I'm gonna
do that.
This hurts."
Wow.
But it's culture, right?
Yeah.
In that culture,
Right.
being more stoic is
Is what
more
they do.
acceptable.
Mm-hmm.
That wasn't my culture.
That's right.
So people taking care of people need to understand
The
the
people
culture.
they're dealing with. They're dealing with.
It changes the care.
Yeah.
So again, having that doula, having someone else in the room, that coach, because it just opens the lines of communication.
I agree. I agree.
So we are almost out of time. Is there any others comments that questions, anything else we want to put on the table here?
I would encourage our listeners, if they have their stories, please share your stories. If you have questions that we can address in the future, or concerns that we can address in the future, we want to hear them. We want to
Right.
know, what are you thinking? Is there something else that we can bring to this segment? Because this could be a part 1, 2, 3, 4, who knows, depending on what our listeners want to hear.
Yeah.
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 If you love what you're hearing, please
Subscribe.
make sure you subscribe.
Yes.
Share.
Mhm.
Make sure to share with your friends, your family, those that you know really need to hear these kind of things. We want to make sure that um, you, whether it be what we talked about today or any other time, we want to make sure that we are giving people permission to talk about it,
Yes. Yes.
no matter what it is, no matter how taboo it might be. You should have the permission to talk about it. So before we go out, I just want to talk about or say a couple of things from. I think I'll just do two because of the time. That just recently happened in the news
Mm.
concerning this topic.
Okay.
USA Today in May of 2020 of this year reported on Black women nearly dying from complications because their symptoms were dismissed.
In 2025.
May 2025.
Wow. Symptoms dismissed. Yeah.
CBS News in December 2025. What is today?
December 25. December.
What is today?
The
fifth. Oh my
December the
goodness.
5th, December the
Today is
5th.
December the 5th.
Yeah.
We're just in the 5th day of this month.
What happened?
Man, see, I missed my place. We're just in the 5th day of this month, and CBS said, "Oh my gosh, I lost my place. Where is it? Okay. CBS News said they covered cases from the Black mother that we showed earlier, was forced to deliver in unsafe conditions.
Yes.
One on the highway, they talked about that. African American mothers, delivering on the highway. Another one in the waiting room after hospitals delayed of care. The delay of care.
That one in Dallas, the father delivered his baby. Shortly after, they left that hospital.
Wow. Yeah.
There was one other news in February 2025. It emphasized that while maternity mortality declines overall, and we mentioned this earlier, Black women saw no improvement. These stories highlight that the crisis is not abstract.
Nope.
It's not just, it's happening every day, even this month.
Right now.
Even today. It is probably something statistically, y'all. Chances are something's happening as we speak.
Yep, absolutely.
And that is the scary, the sad, the seriousness of it. Every day in hospitals and communities across this country.
Exactly.
So what are you going to do about it? Thank you so much for joining us on today. Make sure you subscribe. Make sure you share. We are so honored that you would be listening in to HERpresence, where we talk about the things that are uncommon, those things that are taboo. Thank you so much.